The American Brain Tumor Association is pleased to welcome you back to our webinar series. Our webinar topic today is Navigating Your Brain Tumor Care. Thank you to today's webinar sponsor, Novacure, for their support of this program. My name is Vince Rock, Program Manager here at the American Brain Tumor Association, and I'm delighted to introduce our speaker. Dr. Nicolas Gonzalez Castro is a neuro-oncologist at Dana Farber Cancer Institute and instructor in neurology at Harvard Medical School. He is board certified in neurology and neuro-oncology and is committed to providing state-of-the-art, compassionate care to patients with primary brain tumors and brain metastases, as well as patients suffering from neurological complications of cancer and its therapy. Dr. Castro's research efforts are aimed at understanding the genetic basis of cancer cell survival and resistance to treatment in primary brain tumors, with the goal of developing more effective therapies. Thank you very much for joining us, Dr. Castro. You may now begin your presentation.
Thank you, Vince, for the invitation, and welcome to all the viewers that are joining us today for this webinar on navigating your brain tumor care. As Vince just mentioned, I'm a neurologist, I'm a neuro-oncologist at the Dana-Farber Cancer Institute and at the Brigham and Women's Hospital here in Boston, and I'm happy to be joining you today for this presentation. These are some disclosures regarding other academic activities and research funding. None of these are relevant to the contents of the presentation today. I would like to start by highlighting the learning goals for today. After we cover this presentation, my hope is that you will understand why brain tumors develop and how they affect patients. Learn to recognize the members of your care team. Discuss how to prepare for medical appointments and questions to ask when you meet with your doctors. Identify ways to engage in decision-making and self-advocacy at your appointments, as well as learn about activities that you can engage in to support your overall health during your treatment. Let's start by discussing brain tumors. Brain tumors are tumors that affect the brain or other parts of the central nervous system, and they come in two main categories. Those that originate in the brain, so-called primary brain tumors, or those that develop somewhere else in the body, for example, the lung or the breast, and subsequently migrate or metastasize into the brain. Brain tumors that start in the brain are often occurring throughout different stages of life. They can affect children, they can affect teenagers, young adults, and older adults as well. While metastatic tumors are often encountered as patients develop systemic cancers in middle age or later in life. The presenting symptoms of brain tumors have to do with the areas of the brain that are affected by the tumor itself. So just to review briefly the anatomy of the central nervous system and the brain, here we have this picture that highlights the spinal cord, which is a connection between the neurons in the cortex in the surface of the brain and the rest of the body, as well as a way for information from sensory receptors throughout the body to transmit information to the brain. As it comes into entering the skull, the cranial vault, we have what we call the brainstem, this area which is involved with very basic and ancient functions that are conserved through many species. Above all that, we have what we know as the cerebrum, and this is what people think about when you think about the brain itself. It's most of the volume inside the cranial vault, and the surface of this section is the cortex, the area of the brain that is infolded to try to accommodate as many neurons as possible And this is where all the higher processing of brain function takes place. Lastly, at the back of the brain, we have the cerebellum here in green, which is an organ that is involved with coordination of movement as well as coordination of eye movements. And I highlight all this because patients often present with symptoms that can be linked to a specific brain area. So, for example, a patient might present with weakness in one side of the body, let's say the right side. Unlike in a stroke, when patients develop weakness acutely, sometimes with brain tumors, patients start to lose a little bit of strength over time, a little bit of dexterity. If it's their dominant hand, in most people, the right hand, they notice that they're having trouble with specific tasks. And then, if patients are evaluated, oftentimes a tumor is found in the contralateral hemisphere to the side where they have their deficit. Or, for example, if a patient presents with difficulty with balance and unsteadiness, sometimes after evaluation, a lesion in the cerebellum is identified. So it's important to have some idea of the anatomy because there is definite correlation between the symptoms that patients present with and the area of the brain where the tumor or tumors are located. Oftentimes, patients with brain tumors present acutely, and this is in the setting of seizures. Seizures are events associated with abnormal electrical activity in the brain, where the abnormal activity leads to impaired function. So, for example, if we have a seizure in an area of the brain that is associated with speech, all of a sudden the patient will not be able to produce normal speech or understand normal speech when communicating with somebody else. Um, Sometimes a seizure that only affects one area of the brain, we call these focal seizures, can generalize to impair electrical activity throughout the brain. This is what we call a generalized seizures. And oftentimes these are accompanied by loss of consciousness, loss of motor control. It is essentially a prototypic seizure that we oftentimes see on TV, and that can lead to significant injury to the person experiencing the seizure. Another relatively common presenting symptom for large tumors that have grown over time is headache. Headache is a very common condition, and in most cases is due to a primary headache. For example, a tension headache that many of us get with stress, or a migraine. Uh, but oftentimes, patients that end up being diagnosed with a brain tumor will present with a headache that starts slowly and progressively gets worse, and does not respond to standard treatments such as analgesics that are often effective enough to take care of a tension headache or an acute migraine. Another feature that is common in headaches associated with brain tumor is that patients often complain of worse headache in the morning. Sometimes the headache is worse when the patients cough or strain themselves. This is a sign of increased pressure within the brain, oftentimes related to the blockage of the outflow of the fluid that we all produce within our brains in these cavities here called the ventricles, highlighted in a different shade of green in the center of the brain. Sometimes this is produced in this fluid, the cerebrospinal fluid is produced in the lateral ventricles in the center of the brain and then flows out to bathe the entire nervous system. And sometimes one of these channels through which the fluid outflows gets blocked, fluid builds up, and patients can develop a pretty severe headache. So once patients come to medical attention with either acute symptoms or slightly subacute or progressive symptoms, the first thing that should be done, other than stabilizing the patient and making sure that the patient is safe is to evaluate for the presence of a brain tumor once other potential diagnoses have been ruled out. And the best way to do this is through imaging of the brain itself. And the most effective modality to do this is magnetic resonance imaging, or MRI. When patients go into an MRI, they are fitted into a stretcher that goes into a structure that looks like a donut. The face is covered with a special mask um, that then is guided by a system. The head and the mask itself are guided into the bore of the magnet, this donut-like structure, and then patients are there for approximately 20 minutes. There's a lot of noise, a lot of vibration as the images are generated. And then with the MRI, we can really see inside the skull, look at the substance of the brain, and look for the telltale signs of a brain tumor. Once there is imaging evidence of a potential brain tumor, other practitioners and other providers get involved in the care of the patient, and we will introduce them in the coming slide. So that initial evaluation when you present with your first symptoms could possibly happen in an outpatient visit with a primary care physician or with a neurologist, or if it's acutely after a generalized seizure, it might happen in an emergency department. And then you will start meeting a number of other doctors that will be involved with your care at different stages. One of the individuals that you will meet early on is a neurosurgeon. Neurosurgeons are surgeons that are trained to perform operations in the brain and the spine, and they are often one of the first team members that get involved because through the operation, they help obtain tissue that confirms the diagnosis of a brain tumor. We can have a high suspicion of something representing a brain tumor on an MRI, but until we have a tissue sample that is obtained through surgery to analyze in the pathology laboratory, we cannot confirm that diagnosis. So you will likely meet a neurosurgeon that will discuss with you potential operation that will try to remove any abnormal areas that are seen on the MRI, and use that to really establish a diagnosis. The other important aspect of an operation is that for a number of tumors, the surgery itself is the first step in treatment. It can help reduce the amount of cancer cells that are present in the brain and can make additional treatments be more effective. Once you have undergone your surgery, or maybe while you're waiting for your surgery, you will likely also meet a neuro-oncologist. Neuro-oncologists wear often two hats. Most neuro-oncologists, like myself, are trained in neurology, so they're trained in diagnosing and treating illnesses of the brain and spinal cord, and will often assist with the treatment of seizures and headaches and other complications that you might have associated with your brain tumor. But in addition, they are oncologists, and they can help direct the additional treatments that you will receive for your brain tumor beyond surgery. So there's some variability from institution to institution. At my institution, I often meet patients while they're awaiting their surgery, or oftentimes when they present in the emergency department. At some institutions, you will meet a neuro-oncologist after you have had your surgery and a diagnosis is clearly established. I will say that in many centers, particularly in smaller centers and community hospitals, there's often not a neuro-oncologist, someone that is trained both in neurology and oncology, but rather you would perhaps meet a medical oncology. These are physicians that have had training in oncology specifically and will often be involved in treating multiple types of cancers, but they will also have expertise and can help with the selection of treatments that you would need for your tumor. There are even medical oncologists that have specialized in neuro-oncology and are dedicated to caring for patients with brain tumors, and they will be able to provide similar care to that provided by a neuro-oncologist. And when needed for management of neurologic issues, will often refer you to a neurologist. Once the diagnosis is established, your neuro-oncologist will be able to tell you uh, how aggressive the tumor will be and how else it will need to be treated if you know the tumor is to remain under control. So when tumors are diagnosed, one of the aspects that is often related to patients is the idea of grade. Grade is a word that is used to designate how different tumor cells are from normal cells in the brain. So for example, in grade 1 tumors, the cells are, relatively similar. They have abnormalities that make them cancer cells, but they're not all that different from cells that you would encounter, normal cells that you would encounter in the brain. On the other side of the spectrum, we have grade 4 tumors, which are tumors that infiltrate the brain and are very aggressive. And if you look at them under the microscope, they look very different from any other cell that you might encounter in the brain. They tend to divide very rapidly, so you would see a lot of cells under the microscope. They tend to form their own blood vessels to feed the activity of the tumor, and they tend to grow at such rates sometimes that there are areas of dead cells or necrotic areas within the specimen as you look under the microscope. So for tumors, as a general rule, for tumors that are high grade, grades 3 and 4, and sometimes even for grade 2 tumors that are, still, although considered lower grade, are infiltrating. They infiltrate the substance of the brain. Additional treatments are required, such as chemotherapy and radiation therapy. And here I come to another member of your care team that you will often meet, which is the radiation oncologist. And radiation oncologists are oncologists. They're doctors involved in the care of cancer patients that specialize in delivering treatment through the administration of high energy particles, high energy radiation that is used to try to kill tumor cells and arrest the growth of additional tumor cells. And they do this in different ways, but oftentimes patients that receive radiation for a brain tumor receive these treatments in facilities that are specially dedicated for the administration of radiation to the brain. Patients often have a mask done to secure the head and ensure that the radiation goes only to the area of the tumor or the area of the resection cavity that is left after an operation. And they are the ones that will monitor you during that treatment and address any potential side effects during your treatment and evaluate for the response of the treatment. The neuro-oncologist will also be involved usually before you start radiation, and is someone that you will continue to meet throughout the course of your disease. It will be the recurring figure and the person that will follow you over time as you receive additional care. In addition to your neuro-oncologist, your neurosurgeon, your radiation oncologist, you will meet other doctors as well. If your main doctor is a medical oncologist and not a neuro-oncologist, you will probably also work with a neurologist to manage your seizures and other neurologic symptoms. And you will also work with advanced practice providers, nurse practitioners, and physician assistants that also assist with the care of brain tumor patients, as well as with a number of therapists, physical therapists, occupational therapists that will help you recover your neurologic and cognitive function and maintain good function throughout the course of your disease. In patients that are diagnosed with brain metastasis or metastatic tumors to the brain, you will also have a medical oncologist that will be leading the care of your systemic cancer, such as your lung cancer or breast cancer, and they will coordinate the care with your neuro-oncologist and your radiation oncologist, and oftentimes also with your neurosurgeon. So it is often an overwhelming experience to meet so many doctors and receive so many points of view regarding your treatment and so much information that is delivered to you in a vulnerable time when you are just getting adjusted to the reality of the diagnosis of a brain tumor. And I know from my conversations with patients that oftentimes they have a lot of questions that cannot be answered right away just because of the way that visits are structured. So I wanted to share with you some important points to remember as you prepare for your medical appointments in order to get the most out of each appointment and make sure your providers know everything they have to know about your case and make sure that you can get the most in terms of understanding the diagnosis as well as understanding the treatments that they discuss with you. So oftentimes, if you are not cared for at the place where you presented for initial diagnosis, so if you live in a small community with a small community hospital, you might present there with initial symptoms, and oftentimes you will have some initial imaging, your first MRI done there, but you might be transferred to another larger hospital for additional care, or you might have part of your care, for example, your initial imaging and your initial surgery, one hospital, one facility, but you would be referred for subsequent care to a different institution. This is very common for brain tumor patients. So as you are getting set up to be seen at a cancer center or a center with specialized providers to help guide your brain tumor care, it's very important that you communicate with the administrative staff that coordinates the visit to make sure that all your records, all your MRIs, the pathology reports, as well as the slides, which are often reviewed at large cancer centers, get transferred to this center where you're going to receive your care or a center where you're seeking a second opinion. Because without that information, it is very difficult, at times impossible, to really have a meaningful conversation in terms of diagnosis and treatment, because it's not possible to really understand what is the diagnosis and how has the patient been treated so far, what is the extent of the resection. This is how much of the tumor that was first seen on MRI was removed if we don't have any images from after your operation. So oftentimes staff from the place where you were initially treated will make an effort to make sure that your records get sent to wherever you're going to be seen, but it's always important to double check, to call the center where you're awaiting an appointment and make sure that all your records have arrived. It's key to have you know, informative visit when you come in for your appointment. In especially, I would like to highlight that imaging studies and pathology information are critical for your neuro-oncologist or your medical oncologist to discuss your diagnosis and explore treatment. Another thing that is very important is for you to provide your own records. And this is related to making some kind of recording system, keeping a notebook or a sheet of paper where you write down, your symptoms, any symptoms that you have noticed, any changes in your symptoms, and the frequency of the symptoms, anything that you have done to help them, or anything you've noticed helps manage them. And you relate all this information to your doctor when you're seen. Because in addition to knowing about the actual diagnosis from the pathology analysis and looking at your MRI, most physicians are most interested, including myself, we're most interested in caring for the patient and understanding the symptoms of the patient and what are the things that are changing patients, day-to-day activities and their quality of life, and being able to address those. And there is no better source for those records than you. So if you're having frequent headaches, write down, the character of the headache, the duration, how frequently you're having them. If you're having seizures or any kind of abnormal movements or abnormal sensation or difficulty speaking or any kind of behavior that you might be concerned could represent a seizure, make note of that. If you notice or a loved one has noticed that you're having trouble with your speech or your thinking, it's important to know that, as well as any issues with your strength and balance. And then lastly, it's important to prepare a list of questions that you want to ask your physicians when you have your appointment. Oftentimes many thoughts come to mind and we try to remember at the time of the visit and we forget and we walk out, we check out from our appointment, we're in the car and then we remember, oh, I wanted to ask about this. So to avoid that, I encourage all my patients to make a list of all questions that they have and then try to have a time to discuss this during the appointment. Some of the things I highlighted in the previous slide have to do with being an active patient and participating in your care and getting ready for your appointments and trying to elicit as much information as you can during your visits. In addition to that, there are things that you can do outside your regular visits to improve your knowledge of your diagnosis, of your tumor type and how it is treated and what are things that you should expect during the course of your treatment. And there are other sources where you can obtain this information. As I alluded to earlier, the visits that you will have with your physicians sometimes are constrained in terms of time, and there might not be enough time for the doctor to check your symptoms, do a neurologic exam to assess your function, review imaging scans with you, discuss your diagnosis, discuss treatment options, while at the same time have the opportunity to discuss what is known about the biology of the disease, understand different effects that can change your overall prognosis, discuss what is the latest research in one specific area. So in order to address all these gaps that sometimes are formed early on, as many physicians are not able, or to be more specific, oftentimes because of the many things that need to happen during a visit, they might not have enough time to discuss all this. You can take advantage of educational resources at your treatment center or online to learn more about your tumor and its treatments. And I would like to say that it's important for patients to take advantage of these resources, but it's also very important that they refer to that they're referred to the right resources out there, because online on the internet there's a range of quality and accuracy when it comes to resources. So some of the most trustable sources are the American Brain Tumor Association, the ABTA website has great content, webinars like these and many other um, pages and information that are listed on the website. The American Society for Clinical Oncology also has some information. The National Library of Medicine, which is a website that includes a lot of generally basic information of multiple diseases, including brain tumors. And then the Society for Neuro-Oncology has also some resources for patients that are useful for you to learn more about your tumor. In addition to keeping track of your symptoms and everything that is going on at home, by reviewing some of these resources, you can add questions to your list of questions as you prepare for an appointment, perhaps to ask about a recent development in brain tumor research that might lead to a new therapy, or discuss a treatment that you have heard has become available and see if this is relevant to your own tumor. One of the last topics that I also wanted to address is the importance of staying healthy and being proactive in maintaining your health during the course of brain tumor. Uh, and this is also something that falls into the realm of things that patients can do outside the regular care that is received at your hospital or cancer center. So oftentimes after we receive a brain tumor diagnosis, we feel that a lot of control is taken away from us because our neuro-oncologist and our radiation oncologist and our neurosurgeon are dictating our care. But through education, through maximizing how much you know about your disease and how it is treated, and also through active steps that you can take to maintain your overall health, you will be setting up to have the best outcomes in terms of response to treatment, tolerance to treatment, and overall survival. So if you have other health issues, and most of us do, at the time of your brain tumor diagnosis, it is very important that these are properly addressed and managed and controlled in collaboration with your primary care physician. So for example, if you have high blood pressure, or you have diabetes, or you have kidney problems, or any other illness that you might have prior to your brain tumor diagnosis, it's important that you follow closely and make sure that through medication or other interventions, all these things are well controlled. Because through many of the treatments you receive as part of your brain tumor diagnosis, many of these issues, underlying health issues such as high blood pressure or diabetes, might worsen. And this is an unintended consequence of some of the treatments that we prescribe. So although your neuro-oncologist and your other members of the oncology team will become central in your mind in terms of your healthcare, your primary care physician also remains a very important figure and someone that can provide a lot of support managing your other underlying diagnoses. I want to spend a few minutes to talk about exercise, because it is often the case that patients ask about what are measures that they can take at home to set themselves up for the best possible outcome in terms of how they respond to the treatment of their brain tumors and extend their overall survival. And I find that most patients are interested in supplements, in vitamins or other supplements, herbal supplements, as well as in diet. And I'll say a few things about diet in a few minutes, but I want to stress that the most effective intervention that you can adopt and you can be in control of in terms of maximizing your overall health, and as a result, your outcomes as a brain tumor patient, is to engage in a formal exercise regimen. If you're not exercising already, this is the best time to start an exercise routine and to reap the benefits from exercise. There is an ancient Chinese proverb that says, the best time to plant a tree was 20 years ago, and the second best time is right now. And this applies to exercise too. So if you do not exercise regularly, did not start exercising when you were a child or a teenager, and have fallen off the bandwagon, I encourage you to, in discussions with your physician, after getting approval in terms of engaging in exercise, and it's important to discuss with a physician before starting in any exercise program, but I would say that most patients, the vast majority of patients, including brain tumor patients, are safe to exercise and would benefit from exercise. So after discussing with your physician, meet with a physical therapist or a trainer, or if your physician has experience in providing an exercise prescription, to get an exercise prescription with recommendations for aerobic and exercise and resistance training, and start doing something every day. You know, a good rule of thumb is just to adhere to the Surgeon General's recommendation, which encourage between 150 and 300 minutes of moderate intensity aerobic exercise. So this is between 20 and 40 minutes per day of aerobic exercise. And you still get benefit at the lower range. So if you can only do 20 minutes of walking every day, continuous walking, you will still be benefiting from that, as well as 2 to 3 days of resistance exercise that can be done just with your own body weight. Simple exercises such as squats and sit-ups and push-ups that can be modified also if you are deconditioned and your strength level is not where it should be. So I would highly encourage you to work on this aspect. Is the one that has the best cost benefit ratio in terms of getting a benefit out of other interventions. Sleep is also very important for brain tumor patients and for everyone in general. Disrupted sleep can lead to worsening metabolic health, can lead to increased seizure frequency, can lead to worse mood. So if you're having any sleep problems, it's important that you talk to your neuro-oncologist, or if you're not being seen by a neuro-oncologist that is trained in neurology, to be referred to a neurologist or a sleep doctor to try to address those problems. I think good, consistent sleep over time will have a number of benefits, in terms of overall health, in terms of mood, in terms of cognition. So this is something that should not be left to chance. And lastly, I would say that it's important to maintain a healthy diet overall to maintain or achieve a normal weight. And there are no diets for which we have evidence that have provide a benefit in terms of extending survival for brain tumor patients. So I tend to recommend a Mediterranean diet, and this is a diet that is based on fish and whole grains and olive oil and other lean meats and vegetables, of course, and fruits. So what we all know to be an overall healthy diet, not eating too much, and avoiding processed foods. I think that one useful piece of advice is the haiku that the science writer Michael Pollan put out in terms of diet advice. And the haiku is, eat food. So things that you would recognize as food, things that grow in a garden, things that your grandmother would recognize as food, not too much. So do not eat in excess. And the last piece of the haiku is mostly vegetables. And notice that it says mostly, it doesn't say only. It's important for you to eat protein, and good sources of protein, and animal protein is the best source of protein out there. But the key is to avoid highly processed, high calorie foods that might have a high calorie content but low nutritional value. So eat food, not too much, mostly vegetables. With that, I would like to leave you with a few key points to remember. The first one is that brain tumors can develop in the brain or the spinal cord or arrive in these areas after originating in other areas of the body. These are the so-called metastatic tumors. The care of brain tumor patients is multidisciplinary and often involves neuro-oncologists, neurosurgeons, and radiation oncologists, among other providers. In order to make the best out of each appointment with your medical team, you should prepare. Make sure that your records have been received and are available to your doctors to review, and think of questions in advance to be able to clear those doubts that you have in your mind regarding your diagnosis or its treatment. And then it's important to note that you have control that is not only up to your neuro-oncologists and your other doctors to uh, put you in the best position to do well with your brain tumor. There are things that you can do, including addressing your underlying health problems with your primary care physician, exercising, the most important thing you should do outside, formal, medical interventions, as well as, sleeping well and adhering to a healthy diet. With that, I want to thank you for your time, and I'm happy to answer your questions now.
Thank you very much, Dr. Castro. We will now take questions. If you have a question you would like to ask, please type and submit it using the question box in the webinar control panel on your screen. We'll answer questions as time allows. So Dr. Castro, we do have a few questions that have come in. The first question is, what are some important considerations that patients and families should keep in mind when deciding what treatment options are best for them?
Thank you, Vince, for that question. So when your doctors discuss a treatment with you, it's important to understand what the treatment involves, the specifics of, is this a chemotherapy? If it's a chemotherapy, how am I going to be taking it? Is it a pill? Is it an infusion? How often do I need to take it? What are the side effects that I should expect? What are the most common side effects, and also some rare side effects that I might need to be aware? Because oftentimes most drugs have specific, known side effects. So for example, oftentimes chemotherapy causes nausea, and that can lead to vomiting. And a chemotherapy can also lead to lowering of the blood cell counts. But there are other rarer but serious side effects that sometimes are encountered. It's important to ask about those as well. The other important thing to discuss is to try to have an idea of the benefit that we should expect from a given therapy. For a good number of brain tumors, we have effective treatments, treatments that keep the tumors under control and can help patients live longer, but we don't have formal cures. We don't have treatments that completely vanish every single tumor cell. So it's important to understand in discussions with your doctors, what is it that are we expecting from this therapy? Are we trying to keep things at bay, achieving disease control, or are we hoping that this will clear things completely? And if we're expecting, a benefit in terms of disease control, how long is it that we are hoping that this will keep things under control? So understanding the mechanics, the logistics of a treatment, understanding the potential benefits, understanding the side effects are the main things. Also, at a higher level, it's important to understand also what is the landscape of treatments. Oftentimes a doctor will discuss a specific treatment, but what else is out there, and what is the evidence for other treatments? These are things that can be learned in the appointments with the doctor or also through some of the resources that I highlighted during the presentation.
Thank you. As you mentioned earlier in your presentation, often people will seek a second opinion regarding treatment options. And in some situations, people will get differing opinions from reputable institutions. You just mentioned a lot of really great things for people to consider, but is there anything else people should consider when in that situation of two different really good treatments that they're offered?
Yes, this is an important question, and oftentimes this comes in the setting of discussing clinical trials. For the standard treatments that have been approved by the Federal Drug Administration, the FDA, and are prescribed throughout for brain tumor patients, this is what we call the standard of care. We have a clear idea of what kind of benefits we should expect because they have been approved based on studies done on large numbers of patients, and we know, that this treatment will extend survival by an X period of time, 5 months, 6 months, 10 months. For experimental treatments that are being evaluated in the context of a clinical trial, we don't have that information up front. So just to give the audience some background, a clinical trial is an experiment, essentially, one in which we are selecting patients with a specific diagnosis. So nowadays, where the classification of brain tumors, both metastatic brain tumors and primary brain tumors, is very specific and based on molecular features of the tumors, oftentimes a trial will select patients with a diagnosis of IDH mutant glioma grade 2, okay? And only patients with that specific brain tumor diagnosis will be evaluated in the study. And then when patients are selected for the study, they're offered a novel treatment, something that holds promise based on experiments that have been done in the laboratory with tumor cells on a petri dish or with animal models, mice, for example, that have been modified to form tumors that are similar to human tumors. And when given to cells or mice, the treatment seems to be effective, and then that's brought into the clinic and made available to patients through clinical trials. So that's the experimental arm of a study versus the control arm, which is often offering standard of care therapy to patients, okay? These are so-called randomized control trials where patients are randomly assigned to either get a new treatment or get standard treatment. There are many treatments that are offered in clinical trials that are single arm, where everyone gets the novel treatment, and then how those patients do is compared to historical controls. One thing that is often not done, and I would say that for high grade and invasive tumors is never done, is to give patients a placebo. That is to not give a treatment to a group of patients. Oftentimes in clinical trials, in brain tumor clinical trials, every patient is getting a treatment. Oftentimes is a standard treatment, but no patient goes without treatment, unless it's a very slow growing tumor or somewhat indolent tumor. So I come back to your question. So you go to center A at a large academic medical center, and they recommend a novel study that is evaluating a specific therapy. And then you go to center B in another city, another large hospital, and they recommend treatment B. So the key thing there when you're comparing two clinical trials is to look at what the trial involves, what are the logistics. Oftentimes, patients will need to travel and have very frequent visits. This puts a lot of demand on patients and families' time. And for some patients and some families, this is okay, but for some, it will be too much. So having an idea of what the trial itself involves, having an idea of what the side effects to be expected, if they're known, of this novel therapy, Some of them could be risky, and it might not be worth it to explore that if there's a high risk of experiencing a severe side effect. And then the other thing is to try to get an idea of how advanced the science that went into the trial is. So trials are done in phases. So you'll hear about a phase one, phase two, phase three. A phase one trial is one that is just looking at safety. There is no information regarding efficacy of this treatment, but this is a novel therapy that has never been studied in humans, has only been studied in cells and mice, and now we want to bring this to patients. And the first thing we need to make sure is that we're not going to make patients worse by giving this treatment. So these are small studies, usually enrolling 10, 12, 20, 30 patients. And the main outcome that they're looking to evaluate there is, what are the side effects, the adverse events that patients experience, and what are, what is the safety profile of the drug. They will look for efficacy as well, but the main goal there is to look for safety. Then we go to a phase two trial where we're trying to see if the treatment has an effect on the disease itself. Is it killing cancer cells, and can we measure that in one way or another? And then there are phase three trials where we're comparing whatever new treatment we're looking into versus a standard treatment to make sure that we have something that is new and is also better. So phase three is a definitive trial, and one that then leads to an application to the FDA for approval of that drug. So if you're comparing a phase two or a phase three trial, you're looking at something that has been vetted to some extent, at least in terms of safety. And you can take that into account in order to decide between two clinical trials.
That's helpful. Thank you. The next question we have has to do with the relationship between a patient or a family and a provider. In some cases, patients or families feel that the provider is maybe not listening enough to the patient, or perhaps maybe not looking after the patient's best interests. If someone is in this situation, do you have any suggestions for how they can get better quality care from that provider or even another?
Yes, I will preface by saying, Vince, that it is my experience that everyone that is involved in the care of brain tumor patients has a natural instinct to try to provide the best possible care. And we're all different, and we all work in different settings and with different circumstances. So I would say that I trust the care provided by most of my colleagues, and we are all patients at some point in our lives, and I think that it's important to keep in mind that most physicians, if not all of them, at least start with the desire to do what is best for the patient. Sometimes, often because of issues related to communication, patients do not get that impression, and they become concerned, as you mentioned, that their provider might not be looking for their best interest. If you have that impression, I think it's important to discuss it and give the clinician an opportunity to explain, spell out why is it that they have encouraged certain treatments or certain decisions, or have had a specific approach about your specific care. I am of the school that I don't make decisions for patients. I make decisions with patients. And my main goal is to educate patients about their disease and equip them with all the information needed to make decisions together. Other colleagues sometimes just take the approach that they don't want to overwhelm the patient, and they will simplify things, and they don't get into much detail, and just outline things for them directly. There are different approaches, and I think that different patients prefer different things. Some patients don't want to learn too much, They don't want to review their scans. They don't want to be overwhelmed and just want someone to tell them how to go about it. So my approach would be to first bring up your concerns with your doctor and discuss them. And it might be an issue of communication. And if it's not, and you're really concerned that you're not getting the best possible care, it's entirely appropriate to seek a second opinion or look for another provider to guide your care. It's your health and you should be in control. And I never take offense when a patient of mine, goes to see somebody else at another center and gets a second opinion. I often consult with colleagues about some of my patients to get another set of thoughts and ideas about how to approach a specific patient. So I think that no good doctor would be offended or upset if you decide to seek the opinion of another doctor or even transfer care.
Great. That is wonderful. Thank you so much for answering these questions, Dr. Castro. And thank you so much for your wonderful presentation today. We greatly appreciate it.
Thank you for having me.
We'd like to thank our webinar sponsor, NovaCure, again for their support of this program. And a special thanks to each and every one of you for joining us online and sharing your questions. We hope you found this webinar to be informative and beneficial. We encourage you to take a few minutes to complete our webinar survey by scanning the QR code on your smartphone or going to the link on the screen. Your feedback is important to us as we plan for future programs. You will also receive a link to complete the survey along with the webinar recording and a follow-up email message in the next few days. If you're looking for more content like this, please check our next webinar, Navigating Your Role as a Brain Tumor Caregiver, presented by Dr. Amy Clara on November 8th. For more information about ABTA's programs, events, and services, visit our website, abta.org, email us at info@abta.org, or call the ABTA Care Line at 800-886-2282. This concludes our webinar. Thank you so much for joining us and enjoy the rest of your day. You may now disconnect.